we've been raising the issue with some of our viewers this morning, sort of what did you manage to achieve at 8 weeks? And there's some extraordinary things that our viewers have done, running marathons and bits and pieces. But for an elite athlete to compete and actually win a Grand Slam while 8 weeks pregnant, that seems to be some feat.
It's incredible. I mean, congratulations to her. There are a lot of changes in pregnancy that are hard to accommodate for. So for anybody, you know, usually in the early stages of pregnancy, they can feel really fatigued, they can have morning sickness, they can have all these different symptoms. I mean, for her, we don't know if she was experiencing them or not, but for her to overcome them, if she was, is incredible, right? And then on top of that, the fact that she was able to train during that time as well with all the changes that occur in the body is also pretty amazing.
We were talking this morning about whether you can achieve things during pregnancy because they are the sorts of things you were doing before pregnancy. So to most of us, taking part in a high-level competitive tennis match would obviously not be something we could suddenly pick up. But if you have been operating at that level, is the pregnancy in any way a setback?
It definitely is. I mean, in the early stages, there are some different symptoms than later on. So in the past, we used to tell people, the medical community used to tell people to stay away from exercise, take it easy, or be easier on your body during the pregnancy itself. But nowadays, the thinking is changing. So we actually encourage people to do exercise. So if they were fit beforehand and they can keep up with that regimen, then for the most part, you know, that is a good thing. Now, sometimes the training has to change. So for example, you know, you don't want to push yourself to the limit, because if you're short of breath, whether you're out of shape or if you're in shape, you know, whatever your limit is where you find it difficult to get air, that means that the baby is probably finding it difficult to get enough oxygen at that time too. Plus, on top of that, regardless of what type of exercise you did before you were pregnant, if you're doing a lot during, especially the second trimester where you're on your back, that's not ideal because it can actually lower your blood pressure and interfere with the blood flow to the baby.